Hello, welcome to the first year BHM course of Guru Nanak Institute of Technology. I'm Dr. Indrajit Bose and I shall be your course coordinator for this session. This paper is entitled Business Communication with a paper code of BHM N102. In this paper, basically, we shall be focusing on the use of English by hospital professionals. Now, all of you have joined the BHM course with the expectation of joining the hospital industry. Now, within a few years' time, you shall be passing out and maybe you shall find a place in the industry. Now, what kind of work shall you be doing over there? In these few years, we shall be acquainting you with the nature of the hospital operations and the kind of administrative work and the management work that you shall be taking up in the course of your official duties and responsibilities. Now, in this paper, basically, we shall be focusing on the workplace uses of English. So, I shall be acquainting you with the managerial functions and the professional uses of English, both spoken and written, in workplace communication. So, if you are a hospital professional, you can be proud of the fact and take your place with other professionals and do us proud. So, today the discussion shall be on Module 3. The topic is effective media for the communication of hospital professionals. In the course of this lecture, I shall be taking a look at the role of communication media and what is communication media as a matter of fact. Then I shall also be exploring the roles of hospital professionals and the media channels available to them, the difference between public and social media and the usage of both by hospital professionals, and the problems with media usage as far as they are there, and some steps towards more effective usage of media. So these shall be the topics which I shall be covering in the course of this lecture. To begin with, what is the nexus or what is the relationship between hospital professionals and the media? By the media, of course, we mean the various channels, mostly of public broadcast, or the channels which foster the interrelationship with the public. Like, for example, radio, television, the internet. Now, please do keep in mind that as a hospital professional, you are doing public service, and it is the broad general public which in fact is what you are serving, and their medical needs and their welfare is what all the medical professionals are taking care of. Sorry. Now, you as service professionals aiding and assisting the full-fledged medical persons in the industry are in the role of intermediaries between the medical professionals and the general public. So you have to keep the public informed at every stage about their medical needs. People do not know, so they want to know. There is a great desire for knowledge. So if I have the need for an operation, let us say that somebody is suffering from a tumor, that person wants to know how to get the diagnosis done. So what kind of doctor to consult? where to get the diagnosis done, what sort of medical tests and imaging would be required. Would you need a CT scan? Would you need a Doppler? Would you need a color Doppler or a plain one? These are all different kinds of queries that you will have to handle as professionals in diagnostics, patient care, and also sometimes operative care, all kinds of medical assistance that people need. Apart from this, disseminating information about medical care to the public. This is something that you will have to keep doing. This is a continuous engagement in which all hospital professionals are involved. So, the first role that you will be playing, most importantly, is in the disseminating of information. So, all about different diseases and their cures. When people want to know, they will turn to the media, they will switch on the television, or they will listen to talk shows on the radio. There, they will get answers to many of their queries. You know that there are various talk shows by doctors on TV, also radio programs. So there, people might ask various questions. Also, there are broad information sheets circulated about prevention or steps to prevent diseases, like steps to eradicate malaria. There might be various steps. So they will be broadcast in the media, given in the newspapers, or given over the television. So information of all kinds, that's the first thing. Next comes the advertising about different kinds of medical facilities, treatment of various kinds in hospitals, nursing homes, health centers, all kinds of medical facilities, diagnostics, trauma care, emergency, where to take people after accidents. All that comes also in the media, because unless you advertise that in the media, people will not know about these facilities. Then again, there are different kinds of information about medical positions, vacancies for doctors, nurses, paramedics, support staff. They are all there in the media. Then again, we find various success stories of patients and their recoveries. This 14-year-old boy suffering from a rare type of leukemia went to this medical facility in Vellore, and he was cured within 7 months. So this success story is a documentary which is circulated. So it's a kind of advertisement about that medical facility in Vellore. So circulation of these documentary stories over websites, television, various site videos, these are all very important and part of the media coverage. Now, we also have to keep in mind that the media might play a negative role as well as a positive one as far as hospital professionals are concerned. Now, how is that? Or how does that happen? You see, if there are lacunae in the medical facilities provided, or there are poor medical conditions, inadequate staff, shortage of medicine and supplies, or patients are not taken care of properly, or doctors do not attend, then we find that all these negative images or factors about understaffed, poor medical facilities in centers are also highlighted in the press, in newspapers, in television reports, in various other internet and media posts. So this is negative publicity. And of course, it is your job as a management professional, after all, in the hospital industry, that you take care of the image of your organization. It is the responsibility of the administration, after all, to take care of these medical facilities, but you must always take care that a negative image is not portrayed in the media regarding any medical facility which you are in charge of. So you have to take care of that. A positive image must always be projected in the media to build the confidence of the people, of the general public in your healthcare system and the facilities. It is only then that commitment and the relationship of trust you will be able to build with your public. And this will foster a long-standing relationship in the future. So keep the image building part also in mind. So we can say that hospital professionals have a very important relationship with the media and dealing with the media, because the media is projecting their work and their workplace all the time. Well, it's a part of the media coverage. And therefore, building a positive relationship with the media and keeping a constant touch and active relationship with the media is very important for all hospital professionals. Now, how they can do this, we are going to explore. Let us see. Now, first of all, as I have already mentioned, maintaining a positive image as a caregiver and an efficient services provider. This is the role and the responsibility of all hospital management professionals. So you have to preserve the image that your organization is efficient, it is oriented towards patients, it is people friendly, it has good medical facilities, it has good infrastructure and medical support, and that you constantly keep touch with doctors and patients in order to provide quality service. So these are certain basic points regarding your organization and its structure that you have to highlight. Also, of course, you are playing the role of a public relations officer, or you are managing public relations. You are fostering good relations with both the public and the media through your job and the functions, the administrative functions which you are discharging. If you take care of your patients, if your patients are constantly in touch with you by phone, by email, by WhatsApp messages, then if they are contacted by media persons about the quality of the healthcare and support and assistance that you provide, they will all be able to give positive stories. Naturally, they will speak well of you if they get quality service. Whereas if they don't get good quality service from you, or if they have serious complaints which you are not taking care of, they will go the first to the media to highlight their grievances if they are not getting any assistance from your side. So you must always be very, very active and vigilant in maintaining good contacts and communication, first and foremost with the general public, because the public is what will make your organization stand or fall. I mean, obviously, it is the quality of healthcare that you provide and the medical facilities which you provide which are important. But of course, you must project the image of a caregiver, that you are kind, supportive, and caring, and you are efficient in dealing with all kinds of medical problems, other kinds of problems, and you provide assistance at the smallest instance. Nothing is left unattended. So, the more active and alert and vigilant you are in providing this kind of assistance and support, the better will be your public relations. And the better your public relations, more important will be your relationship with the media, and the positive image that you are trying to project will naturally come forth, will shine forth in the media coverage. And remember that the media coverage is very, very important. Otherwise, the public will draw a negative impression about your organization and they will go elsewhere and not to you. Now, how is it that you are going to maintain this public relations and to maintain this positive interaction with the media? So, certain qualities you will have to possess as a public relations officer or as a management professional. What are these? First of all, you have to highlight all the services and facilities that are there which you provide, and you have to use the language of advertising and digital media uploading through documentaries, videos, and various other digital media tools. So you have to use this language and you have to use digital media in a very, very positive and reinforcing way. So you also need the relevant technical expertise. If you don't have it, then acquire this assistance from other service providers. You also need a most efficient and streamlined system of patient or customer feedback, because your feedback mechanism is what is most important, as I have suggested, in building positive relationships with your patients and with the public in general, and a good grievance redressal system. So if they feel that their medical problems were not only attended, any other kind of assistance or support that they needed, it was provided by the hospital or by the medical facility in time, then they will be pleased. So this is important. So please have an efficient feedback system and a grievance redressal system in place. Also, you need to be in constant touch with the top administration about improving healthcare facilities. Patients will periodically come to you for various kinds of complaints. They will talk about overcrowding, long waiting times, reports which are not delivered in time. There will always be different kinds of problems. So you will have to think of ways of solving these difficulties innovatively and also alerting the top administration about ways in which customer service can be constantly upgraded. The more you upgrade the customer service, the more you will be providing a positive experience to your patients, and the better will be the image building of your organization, right? So you will be playing a very, very proactive, innovative, and vigilant role. Now, what sort of public media channels can hospital professionals make use of? Well, the broadcast channels that we are all acquainted with are the ones that they will be making use of, like radio, television. It's going to come in every living room, in everybody's house. So remember, if you broadcast programs over there, they will appear before thousands, before millions of people all over the country and maybe even abroad. Newspapers, it will appear in print and people will read in magazines and journals. Again, having a very, very wide circulation and coverage. Also, there are tele-helplines. You know that there are assistance helplines which are advertised. For example, there is Ask for certain people who might be depressed and need assistance. So there is a tele helpline for them. There is a number, so they can call, and you will interact with them and give them the required advice or assistance. You might even direct them to certain medical persons who can help them. So these tele helplines are a great source of support for people in need. You see, people are always distressed by different kinds of medical problems, and they don't know to whom they have to turn in order to get the required assistance or support. They are confused, they are puzzled, they are depressed or disheartened. It is your responsibility to give them the relevant information and encouragement and support so that they turn to the right organizations and the right people for support and assistance. So you play a very, very vital role in guiding people. Of course, nowadays, a very important role is played by the internet or the most widely covered media, which again people are always tuning into, whether it is on their smartphones, their laptops, or in their desktops at home, in the workplace, and in other places. Using the public media channels, you will reach out to millions across the country, in your region, and all over the world. You will capture people's attention, highlight medical breakthroughs, the various facilities provided by your organizations. You will reach out to them, and you will provide guidance to people in need of medical assistance and support. So by using the public media, you will, as I have said, play a very important, I might say, invaluable role in guiding the general public about their medical needs. You will also, in the 21st century, we are at the beginning of the 21st century now. In fact, we have come almost a quarter of this century. So we might say that we are living in the age of digital technology, and nowadays social media channels are being actively made use of by medical professionals and by medical organizations of all kinds. So these channels are very user friendly, and they enable us to connect with large numbers of users all over the country and abroad. Also, sometimes they are very cost effective, and you can cut down on the advertising costs a lot, as well as reach out to millions of people and also remain in constant touch with them by using these channels. So these channels like WhatsApp, Facebook, LinkedIn, Twitter, Instagram are all there. We all make use of them, and you can make extremely positive use of them in maintaining contacts and forging relations with your patients, customers, clients, service providers, and others. And you can provide constant support. You can be in constant touch with them and use them as a messaging as well as an alert service. So doctors and other medical professionals use these to maintain contacts with patients. Patients use them to contact doctors, to send them medical reports, to build connections with them and with other medical persons who provide various healthcare support. Also, you share various discoveries and breakthroughs with patients, and they help in building the brand image of medical organizations and to build the credibility. So they are very, very useful, important, and widespread in their coverage. So they are very, very widely used as well. Now, how to make use of the media? Of course, advertising is one of the most important functions. So you can give advertisements about your medical facilities, your organizations. So you often see ads about hospitals, other healthcare facilities in the leading newspapers and magazines. They are all in color, and they give or project beautiful photographs, color photographs and pictures about the facilities and the support which is provided. You also have websites where people can explore by going through different sections. What are the different departments and other facilities available in hospitals, multi-speciality hospitals, healthcare centers, and so on. There are flash ads that you can give in websites or even in emails, so they keep running. On radio, there are ads about hospitals and healthcare facilities, and of course on television. You also use the media for maintaining contact with the government. So as an administrator or as an administrative professional rather, you have to maintain contact not only with the public and with the media, but also with the government, because the facilities which you have in hospitals, the compliance that you are making or that you are complying with the government norms. Let us say that in a 650 bedded multi-speciality hospital, you need to have certain facilities like a trauma care center, an emergency center, a physical fitness center, a doctor's consultation OPD section. So you have all these. So you will give detailed reports, you will give plans, diagrams to the government. So again, you might even issue a public notification and give it in the newspaper. Again, that you are following healthcare norms like ISO 2001 standards or other standards. You are following them. Again, you might issue a notification and give it in the newspaper or display it in your website. Safety regulations, very, very important as far as medical facilities are concerned. So that you are following all these safety norms, you might highlight in media advertisements about your hospital or your healthcare facility, talk about them, advertise them, and so on. So they're very, very important. These are some of the ways in which you make use of the media. Here, I'm giving certain examples. On radio and television, they are very, very important channels. They reach out to large numbers of people, and you can talk about your medical facilities in a very interesting way, which will captures people's interest and attention. And it will also highlight the features of the facilities which you have. So for example, here in the first image, we see there are two people. One is the interviewer, the other is the doctor. So it is an interview of the doctor in a talk show that is being taken on television. So often medical experts appear. So there might even be a panel of medical experts. So they appear on television and they talk about various diseases, their cures, and what people can do to tackle them. There are also radio talk shows, like here we have a doctor, Dr. Prabhat Chandra Thakur, appearing in a radio talk show. So again, they take place at regular intervals and people tune in to these talk shows and they often listen to these interviews or chats with doctors. And doctors are very, very informal and they spend a lot of time and care talking about and addressing people's queries. So often these are also call-in or dial-in programs like in radio. So the doctor on call is available. You can send an inquiry or any query you have regarding certain disease or certain treatment options, and the doctors will address your queries in the program. So often people avail these facilities of talk shows and dial-in programs. So this is a very, very positive exercise which you can use in radio and television. And it will be your responsibility to take care of these programs and arrange them with the doctors. Again, there are different kinds of ads in digital and print media alike. We see here there's an ad of a MRI machine, scan machine. Scroll to see for yourself. So in the designing, the publication of these ads, you will play the role of a decision maker. So you might find yourself in the position of taking care that these advertisements are highlighted in the press and that they appear at regular intervals. So maybe 3 times in a month or several times in a month. So again, choosing the media persons, the ad people who will create these advertisements. Of course, there will be agencies and experts to take care of preparing these advertisements, but you have to choose the media where the coverage is going to take place and the periodicity of the coverage. Again, you have to prepare reports and check that the advertisements are appearing regularly about your medical facility, about your medical support, about other assistance that you are providing, and you have to report back to administration that people are responding to these advertisements. So here we have the advertisements about the MRI machine or medical infrastructure, then medical supplements, and other kinds of supplements. Again, there are job posts in the media. So as an administrative personnel, you will take care of staffing needs, and it might be your responsibility to take care of arranging for job interviews, calling up people for interviews, sorting out CVs or job applications or sorting online applications and routing them to the proper administrative hiring personnel in your department or in your organization. So you will also take care of all these staffing needs. You might even have the responsibility of posting the advertisements in the media and checking to see that the advertisements appear, or again selecting from some advertisements. You might be given the responsibility of selecting staff from these advertisements, or taking the advertisements and all selecting them and collecting them and reporting back to your administration about all the ads that appear. So here we find there are various kinds of hospital jobs, and of course if you are in any organization nowadays, there are large multi-speciality hospitals. They need people with varying specializations, doctors with all kinds of specializations, paramedics, technicians, medical technicians, nurses, pediatric nurses, all kinds of medical technologists. So you will have large staffing needs, and people are also on the move from time to time. So people will leave, other people will come in. So you will highlight all these media posts. You might be required to give advertisements. You might also be required to collect advertisements and be in touch with your administration regarding staffing. Again, this is obviously very important about the advertisements about your hospital, healthcare center, or medical facility. So again, you might be given or entrusted with the responsibility of seeing that these advertisements are appearing at periodic intervals of time. So you will report back to your administration how many times the advertisements are given, whether the coverage is good across various newspapers, across websites, journals, magazines, whether people are responding. People will call because the numbers or the tele-helpline numbers are given in these advertisements, and you will be in charge of responding to people's calls and queries in these tele-helpline numbers. So are people calling? Your administration will ask you, and you will have to give the report and the feedback. So again, this is a very important role that you will play. Also notice that these ads not only highlight the infrastructure and the facilities which are available in large hospitals or healthcare centers in details, but they also are in different languages. Like here, we have a newspaper advertisement, which is in Tamil. So in various parts of India or in various countries of the world, you might have the same advertisement given in the local language to attract the people, or so that people in that region or zone can understand about it better. So again, this is a very important function. Now, how do you make positive use of the media also? Something more, you will find that you need to take care not only of the public and be in touch with the administration and the doctors and other medical professionals, but that also you have to take care of a large amount of work which relates to the infrastructure and the medical supplies, injections, medicines, equipment, medical equipment of various kinds. So you will have to be in touch with the pharma industry for all these medicine supplies. There are stockists, suppliers, so you will have to be in touch with them. And also, there are regularly advertisements that they post in the media. Also, you might need large quantities. So you will have to float tenders, notices, and quotations in the press regarding your requirements to get the requisite supplies or to book the requisite supplies from vendors, suppliers, and other people. You might also have to make bookings of these requisitions over the phone or by sending emails or other interactions. You need to maintain a large customer base, a client base, and also a database about all these medical suppliers, equipment specialists, and others. You need the database so that you can have a good outreach, you can have quick and easier contacts, and rapid service. Obviously, your patients are waiting for the medicines and for medical assistance. So, the faster you can address these needs, the better it is for them. So, you need to have your database ready, you need to have your contacts in place so that you can quickly place your requirements, get the required medical supplies, and give it to your patients. Also, the more you are using the up-to-date digital channels, you will attract the younger and the more net-savvy customers. So you need to build an effective media presence, talk about your organization, talk about your healthcare facilities, and you have to project a positive image and do trust building with your public so that they will turn to you. So here we see there are various websites. So the website is the place where people turn for online assistance, support. Sometimes they can make doctor's appointments or online bookings. Nowadays, there are even online medical consultations. So doctors are busy people. They may not always get the time for a direct consultation, or maybe patients can be in other places. So if you want a consultation with a famous cardiologist in Bangalore, maybe he is available in Kolkata only once in 6 months. So patients cannot afford to wait for 6 months all the time. So you book an online consultation with him, and it is a management professional who makes this booking possible. Also, sometimes online medicines can be acquired. So online medical assistance and care is very positive direction in which we are moving. And as an administrative personnel, you will be anchoring many of this assistance and providing much of this help. Now, there are some problems with the usage of the media if your exposure is inadequate, or if there is, this is very bad, a gap between the image that you are projecting and your reality, or else that you are providing poor infrastructure and facilities. Sometimes people also make the mistake of giving doctored images and videos to highlight a positive image, whereas they do not provide these facilities. So this is wrong. The press will ultimately expose you. So do not do that. Do not do any falsification of data. There are fake websites, all kinds of false information, cyberbullying, data piracy, all the negative problems which are associated with the internet are there. But you have to take care of these problems. You have to use the media in a positive way to create a public image. All hospital management professionals, as responsible spokespersons, have to be educated in the proper use of language, to use the appropriate channels, and to interact in a proper way. They need to cultivate the brand image of their organization. For this, they can even be given training workshops periodically. They need to be able to choose the appropriate media to project the image of the organization or any other needs that they might have. They have to make their choice as broad-based as possible to tap the public need to reach out to more and more people and to search for newer media means, digital means of reaching out to people. So the media is something which is very important for hospital management professionals to be able to make use of, to utilize on a day-to-day basis in their jobs. I hope that in the course of this lecture, I have been able to highlight some of the positive ways in which you can use the media in order to talk about your work and to provide assistance and support to the public. This brings us to the end of this lecture.